today we're going to be talking about how do we grow respite care in Nevada together. We've heard for now two different half-day sessions about respite care, and I want the groups to specifically talk about respite and try and outline some plans for where you see respite care going in Nevada. Because when we meet back together, I'd like to actually outline some objectives that we might be able to meet all together. And so I want you to talk in groups, talk about where we are, where we're going, and how we can get to where we want to go.
I'm happy to start. Thank you. So I'll just share one comment as far as increasing respite care, and I think it needs to be brought on more attention of the private funders. A lot of the respite care vouchers and everything are primarily state funded, but if there's more private dollars and more interest in the philanthropic sector, it could lead to an expansion of respite care. But I'm going to pass it over to Jackie Folger, who is our recorder, and we'll be sharing her the rest of the discussion with the group.
Thank you very much, Nick. And the group had some really, we really talked a lot about what the need was at first so that we could really decide what direction we were going in. And we you know, certainly the need in our state, and especially here in Southern Nevada, is for seniors and disabled, trying to get information to them. And we spoke about how it's a little cumbersome for some of the disabled people and the elderly to learn to use technology, because we think that there's some options there. We talked about virtual respite quite a bit because of the fact that we are in this pandemic and it doesn't look like it's changing anytime soon. So that seems to be a way to really help agencies to reach out to our people to make sure that they are getting the help that they need. And one of the things that we had discussed was dealing directly with the agencies, such as in our area, Southern Nevada, DRC, trying to figure out a way to make the process of allowing respite workers to be less cumbersome and more streamlined to be accepted by the agency here in DRC, which is Desert Regional Center. We also talked about how problems with people who are allowed to have respite through Medicaid, that they've reduced the amount by another 6%. So most people don't find it cost effective. And that may be one of the things that we could look at, is trying to figure out, like Nick's saying, a better way to fund some of this respite rather than looking for Medicaid dollars or looking for you know, Medicare dollars or whatever else that they're using, or funding through DRC and other agencies. But we did say that technology there needs to be some more training for that for our elderly and our disabled, so that they're able to use some more of these kind of Zoom calls and other abilities to be able to interact with people. And we did find out that there's a few on that through Senior Service, actually offer Kindle Fires to help to train people to use them. And Nevada Lifeline offers a reduced internet service through AT&T, $10 a month if cost is an issue. So we thought that, you know, some of the things that we need to look at is certainly what Nick said, trying to find other options for funding and ways to the process of becoming a respite program would be less cumbersome and streamlined.
Okay, that sounds great. Did you have anything else, Nick, that you wanted to talk about before we move on?
No, Jackie did a great job with covering everything. Thank you.
Oh, okay, thanks. Okay, who had group 2? Who was a facilitator for group 2?
Looks like Diane, but she's on mute.
Okay.
Sorry. It was me.
Okay.
Okay, well, we had a great lively discussion. It was really wonderful. Thanks for all your input. And I think that we started off by saying exactly what does that mean, grow? And I think Barry hit the nail on the head. He said it means to grow the awareness so that people understand what respite is about. And the other is to grow the use of it, because we know that our folks aren't using this great, wonderful tool that's available to them. And so some of the ways we've suggested for awareness would be health fairs, specifically having a table that talked about respite, big giant signs. Maybe we all wore t-shirts that had something clever on them that had to do with respite. Nevada Care Connection is a tool now that is ready to a one-stop shop, so that people who can get to Nevada Care Connection, then they're going to get some care management and some help. The part of the problem is having people to learn about Nevada Care Connection, and Autumn did say that one of the mandates now is outreach, so that these people will be going out into the communities and working with the population specifically. We need to increase the number of our respite providers. One suggestion was we start early. Get younger people to understand what respite is about, so that they can then say, oh yeah, my grandma could use some of that. So if we begin early, that may be of great value, I think does. And then, as we always talk about, one of the greatest things we need to do is to get to the employers, to get to the businesses, so that they can understand and be able to help their staff people. Maybe we need to go through like SHRM, the HR department, so that they would understand what respite is about and how that is of value to the company, because we know that those who are employed oftentimes will have a lot of time spent in taking care of their care recipients, and so it becomes problematic. And the last one was to reach out to specific agencies and organizations that is disease specific. So it's like one size doesn't fit all, just like respite. It's going to be, we have a lot of branching out and shotgunning to do. That's my story, our story.
Oh, thanks so much, Diane. It sounds like your group really came up with some great ideas.
Yeah, they were good.
Yeah, that we can all build on, you know, so that is great. Okay, let's go to, you have anything else, Diane, or kind of?
No, I think anything else, guys, I forgot? I think we did good.
Okay, well, let's go to group 3. Who was the facilitator for group 3?
That would be me.
Oh, hi, Mary.
Hello, Susan. Okay, so we had about 6 people in our group, including myself. I did take the notes. Cheryl came out with some great ideas right out of the gate. But some of the ideas that we discussed, Cheryl Donnell, but anyway, was creating a toolkit for virtual interaction, offering some workshops, both in person when it's safe and virtual, on how to access resources, including respite care resources. Let's see, how to involve more virtual activities, and just a good education on the virtual world. Mindfulness activities, creating awareness of mindfulness activities virtually. What resources are out there for respite in the moment? Does somebody need to take a nap? Or do they need to go take a shower? Do they need to go to the store? These are things that are not always really well pre-planned. So are there good resources, which there are resources virtually that can help keep their loved one soothed and focused while they're going and taking care of themselves. And understanding that it's important that caregivers do give themselves breaks when they need them. Training was a big one, and I heard that in Diane's and Nick's as well, those groups, the training for the caregivers, you know, how it's important to allow themselves to take a break, how to come up with creative ways to equip caregivers with resources. An example Cheryl used was a friend of hers or somebody that she knew was had a Western movie night. So the family could take some time off. They would have a friend come over and enjoy a Western themed movie night with their loved one. So they didn't feel like they had somebody being paid for to take care of them. So it made it more social. You know, and she brought up the point of, you know, being a skill level versus the best time for the caregiver to take a break. The best time for the caregiver to take a break, again, falls into do you need to take a nap? Do you need to go to the store? Is this a good date night for, you know, husband and wife? Family education, focusing in on person-centered care to help generate new ideas, maybe tapping into some meetup groups. There's all sorts of meetup groups out there that people can become involved with from the safety of their homes. And then lastly was access to technology in rural communities especially. Not everybody has a smart device, not everybody has a computer, not everybody wants to have a smart device or a computer, and training is a challenge. So these are things that can be addressed to help grow access to respite and utilization of respite in Nevada.
Okay, thanks, Mary. That was great. Let me just ask one quick question. Since technology is such a challenge, did the group come up with any solutions about that other than, I mean, you talked about virtual training, meaning how to use Zoom and how to use some of the other virtual programs, but was if somebody doesn't have a computer or doesn't have a smartphone or something, did you come up with any other ideas how to reach those people?
Cheryl, you can chime in here, but no, we really did not get into the weeds of that.
Okay, all right, not a problem. I'm just asking because I'm taking notes from all the groups. So, all right, well, thank you so much. You came up with some wonderful ideas. So let's move on to group 4.
That was my group.
Corey, is that you? Okay.
Yes, ma'am.
All right.
So we had some of the same issues, and we had a lot of the same thoughts. The barriers, people come into the house, sometimes they're just to do a job and they don't really care, so they're just checking off boxes and things like that. For people that do have caregivers, the web-based lacks a social interaction, which a lot of people miss, and but you also get the web-based aspect of not being able to for the equipment. So we came up with maybe like they have the internet cafes, maybe we have Zoom cafes where they're socially distanced properly and they can do things at maybe a senior center, and then they connect with, say, one of the Alzheimer Foundation interactive painting groups, or they get their own painting group going and they can all do it Zoom there. Or Mark said that like in Las Vegas, they're doing Wi-Fi buses for kids that don't have actual internet. So this bus got the Wi-Fi single strength enough for maybe a neighborhood of kids, or in this case, seniors. Maybe you park that at something like a senior center. So a senior apartment complex. So we could do things like that. And those were some of the ideas about that. We also thought flyers at places that people are still going to. That would be like grocery stores, hardware stores, feed stores, to get the word out. And, you need respite, you need a break. This is respite, call this. Or, that type of thing. So those were pretty much the ideas. Oh, and colleges using interns. Olivia suggested using interns from the medical schools, either pre-med or the nursing students, and using them as caregivers to help provide respite. I think I got everything. Did I forget anything, team?
If I might chime in there, like the senior centers, they have a list of what's going on at the senior centers. If it's a art class or sewing class, they're here to speak at the senior centers, and that information can get out, and it would be, it wouldn't cost. So.
And that's a good idea. It's just that we have to consider that things are not back to everything opened up. You know, I'm not sure that the senior centers are having those classes right now unless they can social distance. So it's something to check on. It's a, you know, and then if they are, then that'd be a great idea.
Yeah, we were just thinking that they could use them as for the people that don't have internet access or don't have a Kindle or Zoom, you know, a way to get to the Zoom. So they could do it with their friends that are socially isolated at their homes and still all be on the same class, and they could all do the same artwork or whatever it was. That was our thought on that.
Okay. That sounds great. Thank you so much. So let's go on to group 5. Who had group 5?
That was Corinne.
Yeah.
I thought maybe, but I didn't write down my group number. So I have kids at home distance learning today. So for the very first time. So now I've been a little bit distracted. So, okay. So we had some discussion. We had some good ideas. One was, you know, thinking of it a little bit like that mandate for child abuse. So having some mandated reporters that can detect and are prepared to say, hey, it looks like you might be high stress, need a break. And I think that's a pretty good idea. I was saying that sometimes with our business cards, if we see families that are struggling, we sort of invite them to utilize our services. And so if there were more people that were aware of respite, and again, that's getting the word out. I was also saying that now's the time for us to get the word out, because more and more people are understanding what the need for respite really is now that this pandemic has hit. Those who maybe took taking a break for granted are now realizing that those who don't have that ability, how hard it is. And kind of the same along the lines as Corey is getting the word out to those places that already people are going to. So whether that be the gym or like Corey said, the grocery store, where are they already having touches, and can we kind of set up shop in those areas? And then not just checking off the box of, hey, yeah, we have a respite program. How do we help help those programs that are already successful more successful? How do we make sure that they have enough employees, enough funding, so that instead of kind of, you know, starting something new and saying, oh, this isn't out there, it is out there. How do we take those organizations, embrace them, and help them grow to a higher capacity and help meet the need? Because, you know, again, I oftentimes talk mostly about the need for respite for children, because that's the demographics that we work with, but there's not a lot of programs for those families. And so it's almost impossible for the organizations that do provide respite to families for us to reach all the families of children that are out there. And so that was another suggestion, and I'm sure it goes the same as those adult services as well, as there's just not enough opportunity out there to reach everyone. And so how do we make sure that those organizations have the support and the funding needed to make sure that we can reach the masses? So that was basically our chat time.
Okay, sounds good. You came up with a lot of ideas. Group 6 was David Nichols' group, and I actually took the notes for that group. So I am going to go through and talk just a little bit, and then David's going to fill in where I may have missed a little bit out. So the group that David had, people started talking about, you know, to try and get the word out through commercials, or through healthcare fairs, or through newspaper advertising, local TV stations. And as everybody was listing and talking about these things, I just brought up that they're really talking about awareness of respite care. And everybody agreed that that is what they were talking about, that we need to increase the awareness. So we talked a little bit about also what respite, the word, means. And one of our members talked about having both parents with dementia, and that she was walking down the street and somebody in Winnemucca came up to her and said, "Boy, you look tired." And that person happened to be Jenny Cunningham, who we all know from the Respite Care Coalition. So, you know, just paying attention to your surroundings, and, you know, when you're out and people either look stressed or tired or in a hurry or irritable, or, you know, just being a friend and interjecting something without getting too personal. So actually, Jenny Cunningham, you know, was able to say to this person, "Well, you might need some respite care." And then she took an extra minute or so and explained what respite care was. So we talked about how we could do that to get the meaning of respite care out, and to create an atmosphere where we can pass the information on. We talked about providing information at perhaps community support coalitions or organizations. So looking to the community that you're in to see what's available, where you could talk or where you could provide some information. David talked about spreading the word in terms of starting from youth and going up. And so we talked about, you know, that classes used to be able to teach life skills and home ec and things like that. Now their programs are much different. But looking at the educational system and starting with grade schoolers and working up, you know, do they have health classes in school? Is there a health nurse that would schedule something? Is there someone that would be able to, either through Zoom or through in-person, schedule meetings in the schools so that we could talk to the children? So they were looking at the educational system to try and get the word out. And then one of the group participants said that that we might want to look at developing, you know, a circular or something to pass out. Even if we just put something on bulletin boards, you know, respite care is taking a break from caregiving. You know, just a few simple words and posting it, and you know, putting the definition on, or putting, "Do you need a break? You can call such and such," you know. So just using bulletin boards, if possible, in different locations. They also talked in the group about faith-based organizations, that is another means that we can get the word out. I know a lot of the churches aren't even back yet to full service, but they're trying to get back. But a lot of churches have actually respite programs where their parishioners do provide some support to other members. So checking with the faith-based organizations to get the word out, awareness. They brought up in the group about using brochures in doctors' offices, you know, having a little insert there that when people do start going back and are going back to the doctor, that there's the respite brochure that gives information on it. Also talked about the community boards and things like that. So the group that I was in was really talking about how to spread awareness of respite. Not so much the access part. Not so much the not so much the access, where to go to get respite, although that certainly follows with this. But we were focused more on the awareness part. David, you go ahead and I'll stop because it was your group.
Oh, no, it's fine. And you did an excellent job in providing an overview of what we talked about. I was extremely excited about our group because we were able to get the input of actual caregivers. We were able to draw from their experiences, and what we did is we had them explain their experience, and from there we were able to develop our objectives. And that's how we pretty much landed in for the majority of it with the awareness component. Is the commonality was I had no idea about this until this occurred. And pretty much that's all overall what we were talking about is just developing the culture, making this a cultural thing, developing the culture where people understand what is available, and have that. In order to develop this, we have to provide that education and awareness. So, Susan, you did really great, and I don't have anything else I can add to it.
Okay. Well, thanks, David. I think all the groups did a wonderful job. And probably not now, but in at least my closing remarks, I'm going to ask for everyone's support and maybe volunteerism for some of these objectives that we talked about. I want to thank all of the participants in all the groups. These are wonderful ideas and we need to build on them, and we are going to need everybody's support to make things happen.